మార్నింగ్.
భార్గవి నేను
గుడ్
ఆపరేట్
మార్నింగ్.
చేస్తానమ్మా, నువ్వు అక్కడి నుంచి ఏం చేయకు.
ఓకే
నేను స్క్రీన్ షేర్ చేస్తాను.
ఓకే
ఓకే,
ఓకే
సో మీరు జస్ట్ అటెండెన్స్ తీసుకోవడం అవి చూడండి.
ఓకే
ఓకే, యా. So is my screen visible?
Yes, ma'am.
What's the title? Slideshow on pedtana ante I'm having a problem if I'm putting title as slideshow. I think I can't see the rest of you, but let me see. I'll go to slideshow. Yeah, am I audible still, Nandan?
Yes, ma'am.
Right. So I'm talking about introduction to epidemiology, and as I said earlier, epidemiology is one of the most important chapters that we see in the textbook of community medicine and in the practice of community medicine. So what this is about and how we talk, what it is actually, we will go through the introductory class and the next 10 to 12 classes. And I'll be giving assignments at the end of each class. So make sure that you do the assignments. Sometimes they may be group tasks, sometimes they may be individual tasks. However, I expect everybody to participate because these are online classes. It is very difficult to hold your attention unless we have a commitment from each of you that you yourself are also interested in learning, right? Yeah. So can anyone from the participants identify the picture and what is the activity which is going on here? I want somebody to respond from roll numbers 1 to 10. Hello. Can you hear me?
Yes, ma'am. You're audible, ma'am.
Acha, so you can't identify the picture and activity, yeah? That's the reason why y'all are all keeping quiet. Okay, so this is a picture of Edward Jenner, and all of you can identify. Now tell me what is the activity. If any of you have gone to the medicine department, you would have seen a similar picture outside the HOD's room as a painting. I don't know if it's still there. It was there a few years back. So can anybody tell me what the second picture is? The second picture is of Edward Jenner vaccinating a 8-year-old boy called James Phipps. Okay, he was being given the cowpox, and if you see in that picture, we have a cow maid who is dressing her hand. And all of you, I hope you can recall that story. You would have heard of it in your microbiology when smallpox was so rampant, and people would often take the smallpox pustules to get smallpox to prevent the severe form of smallpox. Jenner observed one cow maid saying that she will not take this smallpox as a pustule, whatever that pustule secretions, because she said she already had cowpox. That made Jenner to think, is it true that having cowpox prevents the smallpox from coming? So he took a little bit of the pustule secretions or pustule material from the cow maid and gave it to Phipps. This is the first officially documented vaccination process, and this word vaccination derives from the Spanish word vaca, which means cow. So this is how we have one of the most important prevention interventions in the history of science. Edward Jenner and his contribution to prevention of smallpox through the introduction of the cowpox pustule material. Okay, so that is the thing. So why I'm talking today about this is, so prevention often, as we all know, prevention is better than cure, we say, and in preventive medicine, we need to identify different measures in which we can prevent diseases. So observation goes a big way. The first step in prevention would be through keen observation. So let me talk about another important scientist or and his contribution to preventive medicine. So anybody, can you tell me what is Ignaz Philipp Semmelweis contribution to medicine has been? Now especially we are all advocating it in different scenarios, especially now I'll give you a clue. It has a bearing even in COVID appropriate behavior. Can anybody take a guess as to what Semmelweis has said? Okay. I don't see the chat section, so I'm unable to. My view is I'm just able to see my PowerPoint, so I'm not able to know whether you're responding or not. Okay. Bhargavi, can you change the way I am sharing the screen, or can you make me see in another form? Well, what is Semmelweis' contribution was? Semmelweis was born in Europe. Okay, he was born in Vienna. Initially, he trained to be a law student, and later he joined medical practice. At that time, he used to be posted in the wards, what we call now the wards. They were called the first and second clinics. And he found that there were women were dying in the postnatal period, and it used to be called childbirth fever. They used to die from a condition called childbirth fever. And Semmelweis found a very surprising observation. In those days, in his hospital, there were first clinic and second clinic operating on 2 days for all the women who came in labor. So one day it used to be the duty of the first clinic, and second day used to be the duty of the second clinic. And the first clinic used to be operated by the physicians and the medical students, whereas the second day it used to be the services used to be provided by the midwives and the nurses. Semmelweis, to his surprise, found that the number of childbirth deaths were more in the women admitted in the first clinic days as compared to the second clinic days. And later, few other observations he observed were that the first clinic, the doctors who used to come to attend on the women in labor used to come directly after conducting autopsies without washing their hands. They would come directly to the wards. And he proposed that perhaps it is the doctors themselves who are introducing the infection to the wards, to the women in the puerperal period. Of course, can you imagine what a situation that would cause? He was considered to be very controversial for having even suggested that, and people were not willing to accept that his hypothesis could be correct. But later, few years after that, one of his good friends, a physician himself, died after being injured by a knife by a student who was conducting an autopsy. And when they did an autopsy on that friend, they again found that he had similar changes, he manifested the similar changes as the women who had died from childbirth. The autopsies revealed similar changes of women who died in childbirth as well as his friend who died after receiving an injury in the autopsy room. So this further strengthened Semmelweis' argument or view that hand washing has a role to play, and the infections can be reduced by this simple procedure of hand washing. So he made a protocol and he presented, which was accepted. So the medical students and the doctors had to wash hands, scrub their nails, and then enter the clinics where the deliveries were conducted. So after this, the demonstrable change that they saw was the mortality rates in the women admitted in both the first clinics as well as the second clinics came to be equal. So this was supporting Philip Semmelweis's uh, argument or observation about his hypothesis that hand washing was a very important step to prevent a puerperal sepsis. So, mind you, what was done in the 19th century has a bearing now also. Unfortunately, Semmelweis did not publish his presentations findings for a very, very long time. So the credit that was due to him was not given immediately. However, we all have benefited from his observations, and we need to remember him for the good work done. So today now when we are talking about COVID appropriate behaviors, so when we are mentioning our MSM, so we are talking about masking and then uh, keeping social distance, and again we are having this SMS, social distancing, sanitizing and masking. So sanitizing includes hand washing. Okay, so we move on to the next scientist. I'll tell his story again a little later because already we are late. But today, in my class of epidemiology, by the end of this class, you should be able to define epidemiology, differentiate between clinical medicine and epidemiology, and you need to list the various tools we use in epidemiology to measure the disease. So, as we said, epidemiology is a word. The etymology of the word epidemiology means epidemos. Epi means upon, demos means people. So, study amongst population. This is the basic origin of the word. And if you have seen earlier centuries, we used to have more communicable diseases. The deaths among the people were more from communicable diseases. So the initial definitions of epidemiology were focusing on that, and they said the study of disease as a mass phenomenon. Greenwood gave this definition in 1934, and McMahon was another epidemiologist who said the study of distribution and determinants of disease frequency in man. This was a definition given by McMahon Pugh. So, the most accepted definition by worldwide is the definition given by John M. Last in 1988, and it has been epidemiology has been defined as the study of the distribution and determinants of health related states or events in specified population and the application of this study to the control of health problems. If you have noticed here, I have highlighted some of the words in red, indicating the importance of each of these words. When we are talking about study, that means for us, mostly we mean study, we say by gaining more knowledge. That is what we say when we say study. So here the term study means study is the procedure, how we are doing either by observation or by experimentation or by surveillance or by monitoring, we are getting to know more. So that is the word here, the meaning of study here is. And what do we study? By this observation, surveillance, monitoring, experiment, what do? We study the distribution and determinants of health related states or events. So, what do we mean by the term distribution? Distribution means it is how is this particular event that we are studying, how is it distributed? What is the magnitude of that event? So we are no more talking only about diseases. In the earlier definition, if you see, they were talking about diseases. But here we are talking about health related states or events. I'll go more into the examples of what would mean health related states or events. But when you're talking about distribution, in whom it is occurring, where it is occurring, and when it is occurring. Now, determinants. Determinants means what determines why somebody develops the disease, why somebody does not develop the disease. So, these are all the various aspects that we study under epidemiology. Now, coming to these two words, the health related states or events. What do we mean by them? So, as we know, Diseases are definitely a specific entity, but sometimes we have conditions which are not diseases, but they are still important. Like, for example, childbirth is a state, but it is important. The events, so health related state. So, a person's what do you say, biochemical parameters are important. Like, for example, all of you, after your classes in non-communicable diseases, can name me that must know now that non-communicable diseases most commonly are attributed to 4 lifestyle risk factors. So these lifestyle risk factors could include raised cholesterol levels, increased body mass index, so obesity in other words. So that is a health related state. It is not related to a person, a disease specific. So it is a health related state. So a person's blood sugar values could be a health related state. Now coming to examples of health related events. So here you may have, so always, like you could say, an example of a health related event is uh, you could say a gathering. A health related event is a birth or a death. I mean, death is definitely health related. A birth is a health related event, and then uh, overcrowding is a health related event, and so on. So these are specified in specified population. What are these health related events? How they are being influenced by various conditions is what we need to study. We will talk more about the various health related events in the next few classes. So why do we need to know about this distribution of these health related states or events? So the simplest health related state is diseases, but it's not just limited to diseases. It can be about other conditions or situations like parameters, physiological conditions, the environmental factors, and so on. Why do we, and the key word is they are to be in specified population. This specified population may be as small as a village, or it can be as large as a state, or it can be even larger as the world. And why do we need to study this distribution and determinants of health related states or events is by knowing why this diseases is occurring, or by knowing what diseases are occurring, what are the problems, we can apply some solutions so that we can ultimately control the health problems. So through epidemiology, we would be the aim of epidemiology is to identify the health problems and identify the factors which lead to these health problems, and then we also offer solutions to control of these health problems. So ultimately it leading to healthy living among the whole population of the world. So that is epidemiology. So in epidemiology, what do we measure? As I said, distribution of the disease. And we also measure the frequency of the disease. Here I'm using the word disease to make it more simple for you. But as I said, it could be related to even health related states. So distribution of the disease, the frequency of the disease, and the determinants of the disease are often measured in epidemiology. So what do we mean by disease frequency? So disease frequency is nothing but the rate at which the disease or health related event occurs in a given population. So it is the number of episodes or the number of times the disease has occurred in a given population. And we usually measure it as a rate or a ratio. So for example, we may talk in terms of incidence. So like for example, in a suppose you take a village of 1,000 population, and then you find that there is an outbreak of measles in it, and we have that there are 10 children affected in it. So then we may say, or 10 people are affected from it. Then we may say the incidence of the disease is 10 by 1,000 into 100, is around mm, 1 per 100, right? That is the incidence rate. So why we need to know about is, like for example, if you take tuberculosis, we know that tuberculosis is still one of the important communicable diseases which is contributing to morbidity and mortality in our country. In fact, it is the only communicable disease which comes in the top 10 in our country. So now the measures are on to eliminate tuberculosis from our country. But to know that, we just need to know first how many people are newly developing the disease. So you could say that the incidence of tuberculosis in our country is something like 150 per 1 lakh population. So that is how you need to measure the disease frequency. So disease frequency helps us to know the burden of the disease. When I say it is around 150 per 1 lakh population, it may not make much sense to you. As a technical person, I may be interested to know what is for every 1 lakh population, we have 150 new cases of TB occurring. But at the level of the policy maker or at the level of the government where there is a non-medical person looking at it, if we can present that we have around 1.8 million cases of tuberculosis in our country, and India accounts for around 1/4 to 1/5 of the global burden of tuberculosis, that makes an impression. So measurement of this disease frequency helps us to showcase or highlight what is the problem that that disease is causing in the community, or what is the burden of the disease in the community. Nandan, am I audible?
Yes, ma'am.
Yeah, thank you. So next, coming to the disease distribution. So as I said, we finished with disease frequency. So for all diseases, we need not know the all diseases. But if I were to ask you commonly, continuing with disease frequency, if I were to ask you, what are the common diseases? How are you going to tell me? Because it's already given in your textbook what is the frequency of their occurrence in our country, or you may have had so many number of people are affected by this problem in our country. So that is why you are able to say that these are the common health problems, right? So similarly, next we go to the disease distribution. When we are talking about disease distribution, epidemiology deals with the study of the distribution of the disease. When we are talking about distribution, we talk about the pattern of the disease which is occurring in the population. Always remember, it is a defined population over time, place, and person. So why this is important when we are talking about a defined population is, usually epidemiology is about groups of people. It is not about individual people. So we need to talk about in a place, like whether in a country or in a village or in a state, how the disease patterns are occurring. Is it occurring more in a certain area? Is it more in the rural areas as compared to urban areas? Or is it related to climatic zones? So today, or first let's come to the day, when. When is it occurring? So if you see, every disease has some patterns. They may be related to time, place, or person. For example, malaria. Malaria is more common in the months of June, July, usually with the rainy season, which is associated with the breeding of the mosquitoes. Season like this, the hot climate, we see more of sunstrokes developing. And in the winter, we see more of cases of bronchial asthma. So this is how the pattern occurs. Weekends. What do we see more during the weekends? So problems associated with accidents, drunken driving, and are more common during the time. In time, if you see, night time, we see more reporting of accidents. So similarly, when it comes to the distribution across the place, we know that some diseases are more common in the rural areas, like your snake bites, and then you have worm infestations, and also more malnutrition in the rural areas. Whereas the problems in the urban areas would be the problems associated with air pollution, more problems related to the lifestyle diseases are more common in the urban areas. Similarly, different countries or different regions or different climatic zones also manifest with different types of diseases. So we all talk about yellow fever because we know that we have the vector here, but we do not have the agent. Whereas yellow fever is very common in Africa, some parts of Africa. Whereas in our country, we have the other vector-borne diseases. And coming to the person distribution, as we know, certain ages are more predisposed to certain types of health problems. So the most infectious diseases are more common in children below 5 years, and again we see a second rise after the age of 60 years and so on. This is related to the decreased immunity in these two different, the two, what do you say, outer parts of the range of the disease, of the age distribution, the two ends of the age distribution. Coming to the gender, so some diseases are more common amongst males than among females. Like if you see, lung cancer is more common among males, whereas thyroid problems are more common among females. These differences may be both due to the genetic factors, or it may be due to or biological factors, or it may be due to the lifestyle factors. It has been, in fact, cigarette smoking has been implicated as a risk factor for lung cancer by observing the differences in the smoking patterns between males and females. And this was further solidified when they saw in some of the European countries, when they have compared the smoking rates among women and the lung cancer cases among women. They saw that as the smoking rates increased in women, so did the lung cancer cases, indicating again that smoking was associated with lung cancer. Then marital status has a bearing on the disease occurrence. So it has been noted that STDs and HIV and other such problems are less among married persons than among unmarried. This could be because could be because of their environment, or it could be also because of the social factors that they are more responsible in their behavior. Okay, so and then occupation. We all know as doctors, we do have certain occupational hazards. Hepatitis B is an occupational hazard for all surgeons, whereas radiation exposure in radiology departments leads to an increase in leukemias and other such cancers, skin cancer and so on. So occupational hazards are seen, and people working in with silicosis develop certain types of cancers. And you may have read in pathology about pneumoconiosis, which is related to occupational dust inhalation. So when we are talking about the distribution of the disease in various persons, and when we see that there is variation related to occupation, there is some pattern occurring related to either age or gender or occupation, it helps us to draw some conclusions about what could be the reason for some people developing the disease. So this is about the disease distribution. Now, the second part of the definition in epidemiology is the study of both disease distribution and the disease determinants. So what do we mean by disease determinants? So what makes some people more all of us may be exposed to the TB infection. If you see adults, 40% of adults in India will test positive with mantoux, indicating that we are infected with the TB bacilli. But when you look at the rate of disease, you may find that it is much less. So what makes some people susceptible to tuberculosis? So these are what we study when we are talking about to identify the etiological factors or the risk factor. So etiological factor is easy to study in communicable diseases, especially if they're of short duration. So today we have COVID. So as we all know, the COVID is related to the SARS coronavirus, and it is very clear the agent is a virus. Whereas when we talk about the non-communicable diseases, there we do not have a single etiological factor. The disease is multifactorial in causation. So there we talk about the risk factors. What are the factors which make a person more susceptible? So, like you may find that you and your friends, all of you are having, at your age, you may not have the risk factors for non-communicable diseases. But as you grow older, you may find that there is a difference in the occurrence of heart disease or hypertension or diabetes. And then you will find when you go back and you trace, you may find that the people who develop these diabetes or hypertension may have had some lifestyle risk factors such as increased salt intake, increased cholesterol, or obesity, or so on. So these are what we also need to study. So today we know that these are the risk factors, but there are several conditions or health problems for which we still do not find the answers. Today, the last 1 month we have seen an increased occurrence of mucormycosis, which you may not have heard or seen outside of your textbooks of microbiology last year. But today it's all over the news, and why it is that it has been seen to occur more commonly after the COVID pandemic. And some of the states in our country have also declared mucormycosis to be an epidemic. So now people are curious. We need to identify, the governments, the scientific community wants to identify what are the risk factors for mucormycosis. So earlier studies where mucormycosis was there earlier also, they have identified that diabetes mellitus was an important risk factor, prolonged use of steroids, immunosuppressed states, and such people were more susceptible to mucormycosis. So then why is it causing now this much rise of mucormycosis? Why are we seeing it? This is again an area where we need to take up research or identify the gaps in our knowledge. Now coming to what you're more familiar with. You're used to studying clinical medicine. So you have your medicine, surgery, gynec, you go to the wards and you treat individual patients. So how is epidemiology, the study of epidemiology, different from clinical medicine? So in clinical medicine, the unit of study is usually a case, and the disease occurs in individual. As a clinician, you study the disease in individual patients, and it is usually the patient who comes to the doctor, and the doctor's role is providing appropriate treatment after with the help of taking certain investigations, conducting certain investigations and coming up with a diagnosis. Whereas in epidemiology, if you were an epidemiologist, the unit of population would be a defined population, which may be the entire population who is susceptible or an at-risk population. Like for example, if you're talking about maternal deaths, the at-risk population is only the pregnant women up to 42 weeks after, 42 days after delivery. Whereas if you take COVID, the entire population is at risk. And then the epidemiologist studies the disease pattern in the entire population. And he is concerned with both the sick and the healthy. Why we need to be concerned with both the sick and healthy is we want to compare why some people are healthy and why some are sick. So to make some conclusions, the epidemiologist would need to study both the sick and the healthy. And the role of the epidemiologist is not to provide just treatment for the sick, but to identify the source of the infection, identify the modes of spread, and identify the etiological factors. Based on this, we suggest measures for prevention. And the epidemiologist's role does not just stop with suggesting prevention measures, but again, it continues with evaluating the outcome of prevention and therapeutic measures, and to provide necessary guidance to healthcare administrators. Like for example, if you see we had the COVID. Individual management of COVID would require, if it is a mild case, only management like symptomatic management of the fever and then if there is an inflammatory markers rise, then maybe management by giving steroids, and then also if needed, if there is breathlessness and if there is saturation drops below 94%, giving oxygen support. That would be the role of a clinical medicine expert. Whereas an epidemiologist would be more concerned in why is the COVID still causing, what is the reasons for the second wave? We had the first wave and then the cases have subsided. Then why again are the cases increasing? What is the mode of spread? Is there any other conducive factors which made the disease to spread so on? So the recommendations of the study from the epidemiologists or the public health experts have led that again the role of this SMS, social distancing, masking and sanitizers would go a long way in the occurrence of the COVID cases. So this is how the epidemiologists would make their contribution to medicine. However, here you need to remember that clinical medicine and epidemiology have to work with mutual respect, and they work in relation to each other. So a clinical medicine person would take the findings from epidemiologist to help in his diagnosis. So a clinician sees now a blackish HR on the face or a redness and swelling of one side of the eye. The conclusion or the probable diagnosis he would make now would be a mucormycosis. And how did he make this diagnosis or the probable diagnosis is not just because of his conclusion. It's also because of the increased reports that he has got from the findings which they have been shared by the epidemiologists. And the epidemiologist, how does he benefit from the clinical medicine expert? So what are the signs? Why do we say that probably to make a diagnosis of a disease, we would need to know the definition, like what are the signs? Like today we are talking about COVID. So when do we suspect COVID, or what could be the probable case of COVID? So there we would need to say it is just not only it is fever and respiratory symptoms and or shortness of breath. These would be the working definition for an epidemiologist to see what are the probable cases of COVID. And now again from the inputs given by the clinicians, now also we have the epidemiologist saying that the COVID manifesting this time in the second wave with not just respiratory symptoms, but also with other symptoms such as the GI symptoms or for even conjunctival redness and other manifestations. So this is how the clinical medicine and epidemiology work together for the benefit of the community and for the benefit of the humankind. So how does the epidemiological approach go? So epidemiologist will go about his job by asking two approaches. First is by asking questions. The second is by making comparisons. So what are the questions that we would like to ask? So if you see your chapter, the beginning, it says, I keep 6 honest men. They have taught me all I know. They are what, why, when, who, how, where. So this is what was said by Rudyard Kipling, and it is very apt when you see what are the questions that we need to ask related to any health problem. So the questions related to a health event or the problem is, what is the event? Like for example, now we are having in the recent past, let me give you an example of a non-infection which causes. So we had deaths occurring in the hospital because of lack of oxygen supply in the ICUs, or we may have had a fire breaking out in a hospital which is leading to deaths. So these are they related to health? Yes. So but they're not diseases. So they may be considered as health events. So when we are talking about a health event, it can be as small as a disease or it could be something larger than a disease. So when we are talking about these events, the questions that need to be asked are, what is the event? What is its magnitude? Where did it happen? When did it happen? Who were affected? And why did it happen? So these are the questions which the epidemiologist asks to measure the frequency and to give the various rates and ratios. And continuing related to the health action. So as I said, it's not just study the disease distribution and determinants. So the distribution is told by all these first 5 questions. What is the event? What is the magnitude? Where did it happen? When did it happen? Who were affected? The determinants, why did it happen, will give the determinants about why it happened. Once you know this, the second part of the definition, if you remember, so the study of health related states and events in a specified population and the application of this study to control health problems. So we need to ask the answers, questions, the questions, what can be done to reduce this problem? How can it be prevented? What action should be taken by community, by the health sector, by other sectors? What are the resources required? How are the activities to be organized? What difficulties may arise and how to overcome? Continuing our example of COVID, if we have seen this round of second wave of COVID has been very challenging because the mortality rates have been very high. If you remember in April, we have seen all news all over the media about people clamoring for oxygen beds and so on. So there you may ask, what could be the event maybe? What is the mortality in COVID? What is the event? So you want to measure the mortality in COVID. How many people are dying? Where are they dying? Who are dying? And why are they dying? So is it because, so the actions that need to be done, can they be reduced? Can this mortality from COVID be reduced? Yes. What should be action taken by the community, by the health sector, other sectors? So the action to be taken by the community to reduce the COVID deaths. First of all, follow COVID appropriate behavior. Prevention is better than cure. See that COVID do not occur. You do not spread. Next, when you get COVID, staying at home. And then the health sector. What are the actions to be taken by the health sector? Providing services to both the treatment of the minor illnesses and for providing care, providing adequate beds to the people who require hospitalization. Increasing the ICU setups. What need to be done? Now, what is the role of other sectors? If you see COVID if you see the newspapers, who is talking about COVID control? Is it the district medical and health officer? No, we see the district collector. He is the one who is addressing the problems associated with COVID. Because anytime a health event all health events cannot be managed just by the medical fraternity. So the other sectors involvement, so it could be the revenue department which has to allocate more funds to it, more manpower needs to be involved. So people from other departments have been deployed to control the COVID situation and so on. So this is how other sectors can also play a role in controlling the COVID. So last year when we had the COVID and we had to do quarantine, do you know which centers were used for establishing the quarantine centers? All the schools and colleges which had residential facilities. So all your Chaitanyas and your Narayanas were taken over as quarantine centers. And so how can the medical department do it? We took the help of the district education officer. They in turn through their officers managed to release these facilities for establishing the centers. So now when we are also thinking of the health action, what can be done is we require resources. So when we are talking about resources, we talk about the 3 M's. We require manpower, we require materials, we require money. And the fourth thing, the most important thing is we also require time. The time should be adequate, time should be there. So all 4 need to be. So where do we get this? Do we have enough manpower to tackle? So today we have many entrepreneurs or enthusiastic people saying we are coming forward to support COVID. But would they be able to come and work in the hospitals? Are they willing to provide their services? No. That is why this COVID is putting such a burden on the health staff. Our health system is overburdened by the COVID. Right. And so similarly, earlier, no hospitals, every hospital had maximum 10 ventilators perhaps. Even a King George hospital or a government general hospital for TBCD had maximum of 20 hospitals, because earlier we did not see a situation which required or warranted so much huge oxygen demand. But now we find that there is an equipment requirement, ventilators, oxygen concentrators, BiPAP machines, and oxygen cylinders. All of them are required. So, next, when we are planning our prevention measures or the control measures, we also not, it's just not sufficient to get all the material together or the resources together. How to take up the various activities to ensure that the correct control measures are applied. And while doing this, what are the difficulties that may arise? So these are the various questions that an epidemiologist has to ask and find answers to. Or when we are making our recommendations, we need to answer these. So next, this is the second part. In the epidemiological approach, as I said, we need to ask questions related to both the health event and then to the what is the health action that needs to be taken. Next, coming to the second part, determinants, to draw inferences. Why some people are affected? Why is, like if you see today, why is Kerala doing better than Andhra Pradesh? What is the reason that like cities are showing more COVID cases than the rural areas? So we need to make comparisons to draw inferences. So making comparisons is between groups. So these may be called, again, when we go into the future classes, we'll be talking about various epidemiological studies. There we will be knowing about groups of individuals whom we say when we are doing research, we classify these groups of individuals into study groups and control groups, and we make some comparisons. So can make comparisons between groups of individuals or between individuals or with a standard. So these are how we can make comparisons, and we draw some inferences. Okay. So so the basic measurements for which we use are. So for now, I think I'll stop here, and I'll take any questions you have. Any questions? Okay. If there are no questions, so I'll stop with a summary of what epidemiology is. So epidemiology is nothing but a study of distribution and determinants of health-related states or events in specified population, and the application of this study to the control of health problems. And epidemiology and clinical medicine go hand in hand. Both require the support of each other. Clinical medicine deals with individual patients, whereas epidemiology deals with both sick and healthy populations. An epidemiological approach consists of asking questions and making comparisons. Regarding the basic tools of measurement, which are the rates and ratios and proportions, since we do not have time today, I will be taking in the next class. So, but let me say that rates, ratios, and proportions, simply to put, are rate is the occurrence of a change of an event over a period of time. Ratio is comparison of two unrelated events, and proportion is the occurrence of a condition or event as a proportion of the entire people having that event. Okay, so we will learn more about it. But the assignment for you for next week is, as I said, epidemiology is the study of diseases, the distribution of the diseases and determinants of the disease, and the application of this study to control health problems. So I'll be asking each one of you, this is an individual task, identify one CD or one NCD. Tell me how common is it in India. Tell me who are at risk for developing this disease, and what should be the action to take to reduce this disease in this country. You can tell the actions to be taken at the individual level, family level, and community level. Okay, so because you have finished your already communicable diseases and non-communicable diseases sessions, I'm giving this as your assignment. Okay, I may call any one of you and ask you to respond. Is it clear? So thank you one and all. So on Thursday, I'll be seeing y'all with the answers to the assignment. Any questions? Nandan, am I audible?
Yes, ma'am.
Okay, what is the background noise? I hear the clock tower tolling. Is it somebody's phone ringing?
No, ma'am. Somebody's mic unmuted.
Yeah. So this is again something we need to learn about, make it more this thing. So next class, the first 15 minutes, I'll be randomly picking people and I'll be asking them to share 2 minutes, one slide. Each of you make one slide. And I'll be asking you, see, we have, I think Dr. Shivakumar created one group last time in classroom or something like that. Make a slide. Each of you put a slide, put a your roll number and name and share it in that group. I'll share the details of with Nandan in where to keep our this assignment, and randomly I may ask each one of you to share your slide with me that day or speak in front of the group. Okay. So anyway, thank you so much. And so next week we'll talk about John Snow. We'll also talk about various tools of measurement, and we'll also talk about the measurement of morbidity and mortality. Thank you. Thank you one and all. And please share your attendance with Bhargavi so that Dr. Fani Madhuri or Dr. Bhavani will ensure that your attendance is given.
Yes, ma'am. Thank you, ma'am.
Thank you. So we have 182 participants. So